what is called adenomyosis. What is adenomyosis? This is adenomyosis. Adenomyosis. What is adenomyosis? Adenomyosis is a condition where endometrial tissue invades or break into the myometrium. You will be wondering, what is endometrium and what is myometrium? Or you are confused with this definition, but don't worry, I will explain now. Let's watch together. So with a diagram here, this diagram is a womb. It's a womb, a uterus, right? Now look at it here. Look at it here. I drew two lines here. Then there is a space in between the two lines. This space here you are seeing, it is called endometrium. Why the space from here to here, from this place to here, all of this place down here is called myometrium. Myometrium. Now, when I said the endometrium invading or breaking into myometrium, is that this is endometrium. It's supposed to be on its own, but the problem that this endometrium is looking for is that it's trying now and broke into this area you are seeing here. This area, this place that I pointed here, this smooth area, it shouldn't cross from here, but this, in this situation, it broke into this muscle. This area is the muscle of your womb. Then why this area is the central space, the tissue here, there is a space here, it broke into this area. The process of breaking into this myometrium, it is called adenomyosis. And breaking into it is a problem. It's causing issue for the owner of the womb. Immediately this breaks into this myometrium, you will start having some symptoms. And I am going to name some symptoms when this endometrial tissue breaks into the myometrium. One of the symptoms that you can easily have when you are suffering from adenomyosis is that you may be having heavy bleeding, heavy period, heavy period, which is called menorrhagia in the medical term. Apart from the menorrhagia you are having, it makes your womb, instead of it to be at this size or maybe a little bit more than this size, it makes it to grow bigger like this. You see how this one is now. It makes this one to be more bigger because of this adenomyosis. Is making the uterus, your womb, to grow bigger, as if you have a fibroid or as if you're having fibroids, and it is not fibroid, okay? It's because of this adenomyosis, this endometrium that breaks into the myometrium. And then another symptom you'll be having is that you'll be having fullness of the pelvis. Your womb will be full and you'll be having pain during your menses. That is known as dysmenorrhea. That is painful period. When you are on your period, you start having pain associated with this menses. It could be as a result of adenomyosis. You understand? Adenomyosis. Now let us quickly go what causes adenomyosis for a woman and which group of women in terms of their age that face this adenomyosis. One, the causes of adenomyosis is that when your estrogen, one of the hormones, major hormones in your body that controls the child's bearing issue, is becoming dominant, has a high level of it within your body, which is known as estrogen. Estrogen, if the estrogen level is high, it makes this endometrium to grow bigger, thereby invading this myometrium. So estrogen, number one, estrogen level, high level of estrogen can cause adenomyosis. Two, people who have given multiple, births. If you are giving to plenty babies, you are giving birth to plenty children, you may have issue of adenomyosis. Then those that did myomectomy, that is when they use operation to remove the fibroid inside of you, there is likely that such person may develop adenomyosis. Then CS, cesarean section, or D and C. In that situation, there must be an injury to this endometrium, then disrupting its function. And once this endometrium is being disrupted, it may likely to invade into this myometrium, into this muscle, causing the adenomyosis. So with all of this, there are some of the causes of adenomyosis. But mind you, the main cause is still not understood. So they are still working, studying what could be the major cause of adenomyosis. However, from CS, from excess of estrogen, from D and C, and myomectomy are thought to be some of the causes of this adenomyosis. How do you diagnose adenomyosis? Your doctor will listen to you when you explain that you are having heavy period, intermittent bleeding. That is, after your period, a week later, you start experiencing another bleeding again. Or maybe pain during your period. Your doctor may think or may suggest that you are having adenomyosis. Thereby, he or she will send you for ultrasound or MRI to ascertain if the clinical information as a woman you are giving to your doctor could be as a result of adenomyosis. Now, after the diagnosis, maybe from ultrasound, where mostly adenomyosis affects the posterior region of your myometrium. This area is the posterior, while this right area is the anterior. This area is much more affected when a woman is having adenomyosis because it will invade almost all the posterior myometrium, leaving it to little space or no space at all. But the anterior will appear normal. This place will look very heterogeneous. It will not look uniform compared to the right myometrial area during ultrasound. Then MRI can also indicate if you are having adenomyosis. Then how does your doctor manage this? If the adenomyosis is a mild one, maybe probably secondary to high level of estrogen, your doctor may miss a kind of contraceptive medication for you to counterbalance the high level of this estrogen so that it will be level in line with the progesterone, and also give you some painkiller to reduce the pain you are experiencing during your menstrual period or menstrual phase. Then if all of this is beyond the medication, then your doctor may advise you to go for what is called hysterectomy, which is the medical way or the surgical removal of your womb, in that case, you would have, concluded that you are not going to give birth again. Or if you are done giving birth and you find out that you are having this adenomyosis, which is making you to lose a lot of blood, causing you to have anemia, then your doctor will have no option than to suggest hysterectomy.